Hello everybody, welcome to my channel. So in this video we will be talking about fear, phobia, post-traumatic stress disorder and also a little bit about free-floating anxiety. So first, starting with fear. Fear is a negative emotion that one feels when they experience any threat. So fear occurs for a specific reason. Say for an example, you have an exam tomorrow, and that is common for a person to be fearful of exams, even though they're well prepared or not prepared, because they'll be already aware of the consequences if they do not pass the test. So fear can be manifested in many ways, like trembling, shaking, shivering, sweating, increase in the heartbeat, and also after the disturbing or fearful event is over, the person will be able to overcome it. So this is about the fear. Next, we would discuss about phobias. So phobia is a extreme irrational thoughts about animals, human beings or situations like that. This is an extreme case of fear where the person would do anything to avoid such situations where he is feeling uncomfortable or unease to stay in that particular situation. There are so many types of phobias, and the ones which I have shown on the picture are really a very few types, and phobia occurs for no specific reason. And now we shall see the difference between fear and phobia. So vital for survival is it is very important to have fear. So if one is not at all feared about his exams, so it is very difficult for him to achieve certain goals in his life. Whereas phobia on other side impairs area of functioning, so it is very disturbing and it causes impairment in all the aspects of that person's life. So fear is activated only when there is a real danger or a real situation, but whereas phobia is activated for no reason, even if there is no threat causing by it. So the fear slightly reduces once the consequence is gone. So once the exams are done, we automatically reduce the amount of fear we had before compared to now. But phobias last like at least for 6 months or also more than that sometimes. Fear is something that is instant. It's not observed or learnt, but phobia is a learnt behavior. When a person sees someone behaving in such a way that they are scared of a consequence and are given more attention, then the other person who is observing also might adapt to the same behavior as that of they are showing. So fear is universal experience and it does not cause such impairments or problems, and also can be easily managed by using some techniques. But phobia, as it is more intense, it requires medical interventions, and about 8 to 18% of population, especially in America, are affected by phobias. And also it is very pervasive. It causes impairment and distress in every aspects of a human life. And this was a few differences between fear and phobia, and now we shall see what post-traumatic stress disorder is. So this is almost same as what we discussed till now. So PTSD is a disorder that causes negative or irrational thoughts for when the person tries to recall his negative situations or experiences that he has undergone before. Here the person would have self-experienced the terrifying situation, or you would have watched it or witnessed someone undergoing that problem, which would have permanently remained in his memories and would have been causing distress even after he has got through that situation. So it's very important to seek a medical intervention in that case. There are so many therapies including CBT that might help treating PTSD, and also self-care matters a lot, which might help the person to overcome it or to fight the traumatic problems that he is facing. And most commonly used therapy for treating or overcoming fear, phobia, PTSD or general anxiety disorder is theater therapy. So in this therapy, the client is made to imagine that he is in a theater with a good and comfortable situation with all the stuffs that is required, and he is asked to imagine that he is in a same situation and same environment on the screen also. So the person is asked to reflect himself on the screen In addition, he is asked to imagine that he is exposed to the fear, say he is fear of lizards. So here the person is asked to reflect on the screen that he is exposed to a lizard. Before this therapy starts, the client is asked to recall the hilarious or most funny thing that he has watched recently that has made him feel good, happy. So first he is asked to recall the good memory he had, and then continuing with the lizard experience that he had. After the client narrates the story of lizard and his happy moment in a sequence, now he is asked to rewind it. That is, he is asked to first recall about the lizard and slowly about the happy moment that he had undergone. So now, as this happens gradually, finally the person would recall only the happy and the funny moment that he had encountered recently. So the lizard thing is completely washed out. So this is a gist of the theater therapy that I understood. If in case you guys want a detailed and the perfect example, please click on the YouTube video link that I have provided in my description, and you can watch the complete and perfect example of theater therapy technique. And hope you like my video. Please like, share, comment and subscribe to my channel. Thank you.